We are joined now by the President's Chief Medical Advisor, Dr. Anthony Fauci. Dr. Fauci, thanks for joining us again this morning. So we've seen this announcement of the travel ban from South Africa, reimposing travel bans to other areas. But at this point, are they really going to do any good?
You know, I believe so, George. I think that was a prudent decision because right now, even though our surveillance isn't as comprehensive as we'd like it to be yet, it does not appear that this particular mutant is in the United States, although it well may be. But if you have a free inflow of people from a country in which that mutant is clearly dominant, I talk to my colleagues often in South Africa, it clearly is dominant there. I believe the travel ban will be important in addition to having a situation where anybody coming into the country now is going to be required to have a negative test before they even get on the plane. When they land, to have a degree of quarantine as well as another test. So I believe it was prudent, even though it's never perfect. There's always a possibility and even a likelihood of some slippage. But I think the ban, which was discussed very intensively by the group, was the right decision.
Let's talk about these variants. I know you're concerned about the South African variant. Not sure if it's here yet. We've gotten some evidence over the last several days that the United Kingdom variant is actually more deadly. Explain what we're finding.
Yeah, you know, at the beginning, George, when it was first studied intensively in the UK scientists made a statement which was clearly obvious that this was more easily spread, i.e. more transmissible. When they looked at it, it did not look like on a case-by-case basis that it was actually more virulent, is the word they use, namely more likely to make you seriously ill or kill you. When they went and became more granular and looked at the data, they became convinced that it is, in fact, a bit more virulent, namely making it more difficult when you get to the point of serious disease and even death. So I believe their data. I haven't seen all of it, but from what I've heard, I believe the data.
We're still seeing shortages of vaccines all across the country at this point. I know the president has issued a series of orders that are designed to increase vaccine production. What more can be done right now?
Well, I think it's exactly what the president is doing. We've got to pull out all the stops. We got to find out. You know, there's a lot of disparities that you see and discrepancies, George. For example, you might call up one group locally and say that there's vaccine there. It's not getting into people's arms. It's available. You make a call to another group and you say, we don't have enough vaccine. We have people lined up. We've got to get into the trenches and figure out exactly at that local level what's going on and how to fix it, because President Biden had said right from the beginning he's going to pull out all the stops if things don't look like they're working well. Instead of blaming people, we're going to just try and fix it and jump all over it. And that's what we're doing. It's going to take a little time. You're going to still hear about people who are not getting vaccine, who want it, as well as vaccine that's on the shelf. But hopefully within a very reasonable period of time, that's going to get corrected.
We've had 25 million cases over the last year. You've been under a lot of pressure over the last year. What's the number one change you've noticed from President Biden from President Trump?
It was very clear, George, and it was articulated multiple times. The president has said it publicly, but in a private session, just sitting down with him and with the medical team, he's very serious. He said science is going to rule. We're going to go by the facts. We're going to go by the evidence. We're going to go by the data. If something is wrong, like I just said, we're going to just try and fix it. And we're going to pull out all the stops to get our arms around this. Getting the vaccine situation on track is his highest priority. So, I mean, the idea that the president himself sits down with you and says, I want science to rule, go out there and do everything we need to do to get it done, just is really very refreshing.
You also faced serious personal threats over the last year. I was kind of horrified to read you had one incident where you opened up an envelope and feared you were poisoned.
Yeah, that was very traumatic, George, but more so for my wife and children, who just really, really horrified by that. Because, you know, for a while there, as I said in the Times article, you know, there were only three possibilities. Either it was a hoax, which I was hoping and praying it was anthrax, which would require my taking, you know, 30 to 60 days of Cipro, or it was ricin, which means I was dead, no matter what you could do. So for a point there, until the FBI and the hazmat people figured out what it was a very, very difficult period.
Well, we are glad you were okay. Dr. Fauci, thanks for your time this morning.
Right. Good to be with you, George.
Well, he has been such a steady presence through such a terrifying year.
Yes.
Certainly. All right, George, thank you.
Well, hey there, GMA fans. Robin Roberts here. Thanks for checking out our YouTube channel. Lots of great stuff here. So go on, click the subscribe button right over here to get more of awesome videos and content from GMA every day, anytime. We thank you for watching, and we'll see you in the morning on GMA.